All right, another hidden gem, someone that just once again goes under the radar. And I know, especially if we're talking about mid-calf pain, you know, there's a whole range. Obviously, we've got the gastrocnemius here, muscles, which obviously get blamed for a lot of it. Posterior knee pain in regards to popliteus. Once again, that's another important one. But Mr. Plantaris, okay, really important muscle. I mean, it is it's probably a poor, weak flexor of the knee. Works obviously with the gastros and the hamstrings, but once again can be responsible for a lot of that deep belly calf pain, especially the medial aspect. So I think a lot of people get confused and unsure about where plantaris is and how to palpate it. So if we find our popliteus crease here, that's not where we want to go, all right? So we want to come down probably 1 or 2 finger widths, okay? You know you've got the belly to a certain degree of the gastros there, so the trigger point for the medial gastros will be out in this area here. If we come right around to the side here and we go underneath here, just at the bottom of the condyle, or from the tibia, you'll probably also find that's where the trigger point lies for popliteus. So we've got gastro. So plantaris is going to be in this area here, and that's where the trigger point is going to be. So make sure you're not working into the popliteal fossa, obviously, but in terms of working the plantaris, that's where we're going to be. So once again, it's really important that you try and palpate first. So you feel that there, Dan? Okay, so it's not really that difficult to find that plantaris trigger point. So what I tend to do here in this situation, once again, I like to bend the knee because it takes the pressure off the gastrocs here, which means I can get into that plantaris tendon really well. So that's the belly of the muscle just in there, okay? You'll notice that the tendon comes all the way down the medial, okay? So in terms of working the plantaris, really simple process here. I'm going to come around from the side here. I'm going to sink down. So, yep, I'm going to flatten out a little bit of that gastrocnemius. And as I work up, I'm going to get down just to flex, dorsiflex, okay, which will take a little bit of the pressure off the gastrocnemius. And then I can just sink into that plantaris trigger point right there. So once again, you've got to be really mindful about your client's pressure here. So which I am. Is that too much, Dan? Right on it. Okay. Now the referral they'll probably get 9 times out of 10 will be deep in that medial portion of their gastro. Okay. So if you're searching around the gastro and you're not really able to isolate anywhere, the trigger points in the gastro are not really doing it for you, then I'd be looking at plantaris. Really one that goes under the radar as well. So once again, just taking the time, flattening out, make sure that they're in flexion, okay? Working across, up, and just short of that popliteal fossa, okay? So we don't want to be working in there. I mean, obviously there's a whole range of structures in there that we don't want to be playing around with, but in terms of plantaris, this is an absolute cracker. Alrighty, so remember, mid-calf pain, you're not finding the love with the gastro or even soleus for that matter, please have a look here. I mean, I know also the hamstrings may refer down into this area as well, but obviously, please, plantaris.